Hello and welcome to Pace Hospital's podcast, where we discuss important health topics that help patients make informed healthcare decisions. Today we are talking about mastectomy, a surgical treatment for breast cancer in which the entire breast is removed to treat or prevent spread of cancer. Depending on the patient's condition, a mastectomy may be recommended as a part of personalized breast cancer treatment plan. Joining us today is Dr. Ramesh Parimi, consultant surgical oncologist, who has extensive expertise in diagnosis, treatment, and surgical management of breast cancer. In today's episode, we will discuss everything you need to know about mastectomy, including when it is recommended, the different types of mastectomy, how the procedure is performed, its benefits, possible risks and side effects, recovery after surgery, breast reconstruction options, and what patients can expect during follow up care. Dr. Ramesh Parimi, thank you for joining us at Pace Hospital's High Tech City.
Good evening, friends. I am Dr. Ramesh Parimi, surgical oncologist, and addressing you, interacting with you from Pace Hospital, Madhapur, Hyderabad. Well, today's interesting topic for you would be what's called breast cancer treatment, mainly about mastectomy. Well, breast cancer is one of the solid organ tumors, like breast is solid organ, and we oncologists consider it as solid organ tumors and liquid tumors like that. So, for most of the solid organ tumors in general, surgery is the treatment of choice mostly, whether it is breast or cheek cancer or bowel cancer like that. Now, in breast cancer, for the past 100 years, the standard treatment has been what you call mastectomy.
Let's start by understanding mastectomy operation procedure.
Mastectomy means removal of the complete breast. I'm not going to details of breast cancer, origin, spread, and all that. No. So, when some lady is subjected to mastectomy because of a malignant tumor in the breast, and having done all the workup and the indications and also the suitability of this procedure for that particular patient, the procedure overview is like this. Patient is operated in such a way that the breast which is affected with cancer is removed completely, and apart from the breast, the drainage area, that is the lymph nodal, cancer can spread to lymph nodes, not only spreading locally into the skin, nipple, and also into the chest wall, it can also spread to what we call the lymph nodes. So, there are a particular set of lymph nodes into which the malignant cells or infection from a particular organ drains. From breast, whether the right side or left side, tumors spread to the axillary group of lymph nodes. So, the axillary group is armpit lymph nodes. So, in the mastectomy procedure, the affected breast along with the lymph nodes on that side, which we call ipsilateral side, are also removed surgically. And these lymph nodes in the axilla or armpit on the same side as the affected breast are disposed of in 3 levels, level 1, level 2 and level 3. And depending on the findings preoperatively, either by PET scan or by ultrasound scan or even by nowadays what you call the sentinel lymph node indication, that particular group or particular node are removed. So, mastectomy is a procedure of choice all over the world in specifically indicated case of breast cancer, wherein the breast is removed along with the lymph nodes in the axilla. Well, after removal of the breast, evidently there won't be any breast to be seen on that particular side, and then it will be just a chest wall which will be evident.
Dr. Ramesh Parimi, what is the purpose of mastectomy?
Well, in majority of the cases, when the breast cancer is locally advanced, that's called LABH we call, means locally advanced breast cancer, LABC. Mastectomy is the procedure of choice, and there are different types of mastectomies done. The Pattis mastectomy, modified radical, the Rutherford Varison, so many are there, Waterford. So, depending on the type of mastectomy is performed, the name is given, but essentially it is removal of the breast with the lymph nodes. So, the purpose of this operation is that any locally advanced breast cancer is completely removed along with the skin. If there is cancer cells already present in the skin, in the nipple, in the areola, and base of the tumor, that is breast tissue, maybe on the pectoral muscles, the muscles of the chest wall area, and also the affected lymph nodes are all removed in one go at one stage in the single sitting operation. The purpose is to get what is called RO resection. RO means there is no residual tumor at all. Even when examined macroscopically, the tissue is sent there. The cut margins or whatever you call, that is when the breast tumor, the base of the tumor, that is which is on the in relation to the chest wall fascia, and also the upper and lower medial and lateral edges of the breast removed should not contain any cancer cells even on microscopic examination. The cut margins are absolutely and adequately free from the tumor and also tumor cells. The distance from the edge of the breast tissue removed to the center of the tumor is called the cut margin length and breadth.
So, doctor, what are the indications of mastectomy?
Now, as I told you, the indication is carcinoma of the breast, which is locally advanced, cancer of breast, LAB is locally advanced breast cancer.
Could you explain what are the side effects and complications of mastectomy?
And because of this operation, there are no any specific complications, but while doing this surgery, it's important that the skin, which is going to cover the chest wall later, are adequately thin or adequately thick, whatever. Adequately thin in the sense we should not leave behind any cancer cells in the skin flaps. Adequately thick, what I mean is they should not be too thin that the flaps should not get proper blood supply and they get necrosed. So avoiding this procedure has to be done. And regarding complication, as I enumerated, there is not much of complication, but the skin flap necrosis. Secondly, the collection of lymph, that is the fluid under the skin, that is under the incision or the sutures, and in the armpit, that is called seroma. And generally drains are kept and they are removed when the discharge or the drain collection is much less than say 20 ml per day. These drains are called suction drains, and Romavac is the usual type of drains that are used to remove the fluid which accumulates following this kind of surgery. There could be mild difficulty in using the shoulder joint and the arm movements on the affected side because of the muscles which might be a bit weak following the surgery, called the pectoral muscles might get a little bit of denervated, that is all the nerves might be get affected supplying this muscle. So there may be a difficulty for a short period of time, movement of the shoulder joint and also the arm, upper arm. Sometimes there will be what you call a kind of tingling numbness felt all through the upper arm on the affected side where the surgery is done. That is because of the intercostal brachial nerves being sacrificed during the surgery.
Dr. Ramesh Parimi, what are the advantages of mastectomy?
So the advantage of this operation is that the tumor is totally removed and also the lymph nodes which are affected are removed. It's complete total extirpation of the tumor from the site of origin and the likely spread to the lymph nodes. That is advantage of this operation. It's kind of radical surgery, no doubt.
So, doctor, one final question. What is the recovery time for mastectomy?
Generally, the recovery time from a radical mastectomy of a patient in modern times is about 3 to 5 days. The drains might be there in place for about 3 days in an average. Can go on even up to 7 to 10 days in some instances where the tumor has been quite large and the breast has been quite huge in size, large in size. So these kind of patients who have other big tumors and size of the breast being bit more, they may drain for a longer time and drains have to be kept. So average the recovery time is about 3 to 5 days and drains rarely in some instances may be there in place for about 7 to 10 days. But for that, there is no other major complication coming out of the surgery. So I got the brief bird's eye view overview of the surgery, the purpose of surgery and the indications apart from complications of the surgery, the advantages and recovery time have been discussed. And this is one of the commonest operations performed, especially in our country. where the breast cancer might be diagnosed in stage 2 or say 3. Of course, there are other procedures which follow or this procedure or even precede this procedure called neoadjuvant and adjuvant therapies, having given some chemotherapy followed by surgery and then again if necessary post operatively chemo and also radiotherapy. So this in brief about the operation called mastectomy for breast cancer. Hope it has been interesting and you are able to gain some knowledge about this operation in performed for breast cancer. Thank you very much.
Thank you, Dr. Ramesh Parimi, for sharing crucial information about mastectomy with our listeners. We hope this discussion has helped you better understand mastectomy, including when it may be recommended, the different types of procedure, recovery, and the available treatment and reconstruction options. If you have any questions regarding breast cancer treatment or mastectomy surgery, please do not hesitate to consult an oncologist or surgical oncologist. Remember, breast cancer treatment is a journey that requires early detection, informed decision making, timely treatment, and ongoing emotional support. With experienced specialists, advanced surgical techniques, and comprehensive follow up care, patients can achieve the best possible outcomes and move forward with confidence and hope. We'll see you soon on Pace Hospital's podcast with another informative episode. Until next time, take care, stay healthy, and prioritize your well being. Thank you.